Aesthetics are a huge portion to this, as well. So a lot of patients come in wanting something totally different, but they still want to look like themselves.
And so let's jump on that real quick since you just said that. Explain to the listener why we don't go through digital mock-ups or selection of teeth for our particular process. Why don't we go through that first? Why is that not something that we discuss beforehand?
Right. So I know it seems like a great idea, right? When you look at a set of teeth,
it looks
in a
awesome on
photograph,
commercials
on a celebrity,
and
a magazine, it could look beautiful on that, page, on that screen. But once you put it in your mouth, it looks extremely different. So just right off the bat, we want to set our expectations. Yes, patients can come in with inspiration, with ideas of how they want to look, how we want to shape the teeth. But it's all about the try-in process. It's about fine-tuning it for them, So we dive into that a lot, and we spend time comparing different shapes, different sizes, making sure that we're communicating clearly, that the message is getting across what they want and, if we can achieve that. So.
And it was always frustrating because when you're trying to, let's just say for a conversion, a lot of times it's sort of a standard, very run-of-the-mill kind of type of tooth that everyone kind of picks. Mm-hmm. So you don't get too far out of the way or too far off. But it was always sort of frustrating because once you show somebody an example of what they think that they want to look like, or in any shape or form, right? We used to take the facial scans, we used to take scans of their mouth, and we used to prototype it, and we used to show it in front of them, and we used to use that as sort of a selling point. And that, if you go to a meeting, that's the way that they're going to tell you that, oh, that's the way you close a patient. Sure, fine, that may help with selling, but in terms of actually like performing on the final results, it's very difficult because now you've introduced a thought of what somebody was going to, what they were going to look like. Right. And it's not that you can't achieve that. It's just you've just now kind of muddied the waters more than you need to.
Exactly.
And I always felt like putting them under the gun too, when they're kind of used to, for the most part, they're used to not being or enjoying their smile, putting them under the gun and saying, which ones do you want now? Choose. Right. You have to choose right now.
Exactly.
Why would anyone want to do that?
Right.
But I get the appeal, you get to pick it out ahead of time.
Yeah.
The problem is that reality and ideal don't always mix together properly. Sometimes it's better. Reality is even better than what the fake would come out.
Yeah, exactly.
Beforehand.
And sometimes, and this may sound crazy, but sometimes perfect symmetry, and a perfect smile doesn't turn out so great. There's not a lot of personality in that. So sometimes we can veer off, and start creating different shapes and kind of humanize
I think that the
bit.
easiest way for maybe people that are listening to understand would be there's book smart and then there's street smart, right?
Right.
There's book smart for teeth, and of course we follow the rules and we're not doing anything bananas or crazy.
There's the golden ratio, that we follow as a baseline.
Right. Explain what the golden ratio is, since you said that.
The golden ratio is, it's nature's idea of perfect balance. So it's a set of numbers. It's like an equation. And if followed, it's like 1 to 1.6. So if followed, you can achieve a perfectly symmetrical, balanced anything. So in dentistry, it's a set of teeth, how they look. And
right. It's a ratio of how teeth get progressively smaller visually, how proportioned they are in terms of the height versus the width, right?
Yeah.
And it's a great rule to follow. It's standard across pretty much all of nature.
Even seashells, and, paintings, and
even financial scales, actually. But so there's the golden scale. There is the book smart side, and then there's the street smart side. And there's a balance that will, if misconstrued. There's too much street smarts. There's too much fly by the seat of your
Too much
pants.
by
That'll
the
be a
books.
mess. And then there's too much by the books. So that's where you come into play, is you're sort of the referee between book smart and street smart.
That's
right?
a perfect way of putting it. Yeah, we have to make sure that, clinically, everything is where it needs to be. But from the artistic standpoint, we can have fun with it. We can really kind of go crazy and try out different things, and keeping that golden ratio as a baseline, but then exploring different options.
And
it's been a lot of fun.
In being a referee, how much of that is you having to pull the patient back to reality of, oh, but we can't move this tooth here because it's what's holding your lip out so that it doesn't look like you're missing teeth? Or like, how much of that balance is there? How much of your day-to-day job is reining that patient back into reality? Like, how much of it is them being too artistic with it, or trying to be too creative or too idealistic in their own head, and kind of reining them back into reality? Is it a lot? Or
it's not a lot, surprisingly. Just because they know that, okay, these teeth need to be here, and then everything else we can work with and mess around with. But usually it's pretty easy to get that idea across. Not a lot of times do we veer off so much that it's going to affect what we need clinically. So we're still in that kind of limit. We're still safe.
Absolutely.
So it doesn't come up a lot, really.